Are you all set? Let's get started.
Where does hematopoiesis begin? During the first few weeks of gestation. The correct answer is C. Yolk sac. Which site is commonly selected for performing bone marrow aspiration and biopsy in adults for diagnostic purposes? The correct answer is B. Iliac crest. What hormone is responsible for regulating the production of red blood cells in response to the body's oxygen needs? The correct answer is C. Erythropoietin. What is the scientific term for the controlled and programmed death of cells? The correct answer is B. Apoptosis. Which of the following factors has the potential to affect the results of a hemoglobin examination? The correct answer is D. All of the above. In cases where oxygen delivery to the tissues is insufficient, in which direction does the hemoglobin dissociation curve typically shift? The correct answer is A. Leftward. Which of the following is a characteristic feature of respiratory acidosis? The correct answer is C. Elevated hydrogen ion concentration. In hematologic tests like CBC, which anticoagulant is commonly utilized to prevent blood from clotting? The correct answer is D. Ethylene diamine tetracetic acid. Heparin acts as an effective anticoagulant by primarily targeting which specific protein involved in the coagulation cascade? The correct answer is B. Thrombin. Which of the following is a well-known hemoglobin variant associated with a genetic mutation causing the substitution of valine for glutamic acid in the beta-globin chain? The correct answer is C. Hemoglobin S. Hemoglobin F is primarily composed of which globin chains? The correct answer is B. 2-alpha and 2-gamma chains. Which type of globin chains make up hemoglobin A? The correct answer is A. 2-alpha and 2-beta chains. What is the primary component of hemoglobin A2? The correct answer is D. 2-alpha and 2-delta chains. What is the primary cause of the formation of methemoglobin in the blood? The correct answer is C. Oxidation of iron from ferrous to ferric state. What color does blood appear when it contains a significant amount of methemoglobin? The correct answer is C. Chocolate brown. Which type of hemoglobin cannot be accurately measured using the cyanamide hemoglobin method? The correct answer is D. Sulfahemoglobin. To calculate mean corpuscular volume, which of the following values should be divided by the total red blood cell count? The correct answer is B. Hematocrit. Mean corpuscular hemoglobin is calculated by dividing which of the following values by the total red blood cell count. The correct answer is A. Hemoglobin. To calculate mean corpuscular hemoglobin concentration, which of the following values should be divided by the hematocrit value? The correct answer is A. Hemoglobin. Try to calculate this. The correct answer is B. 8.1 femtoliters. Try to calculate this. The correct answer is D. 25.4 picograms. Try to calculate this. The correct answer is A. 37.5 grams per deciliter. What term or parameter expresses the degree of variation in red blood cell volume in a complete blood count? The correct answer is D. Red cell distribution width. What term is used to describe a condition characterized by a significant variation in the size of red blood cells in a blood sample? The correct answer is B. Anisocytosis. What is the term used to describe immature red blood cells that appear bluish-gray when stained with certain dyes? The correct answer is A. Polychromatophilic erythrocytes. What term is used to describe immature red blood cells that still contain remnants of ribosomal RNA? The correct answer is D. Reticulocytes. Which supravital stain is commonly used to stain reticulocytes? The correct answer is C. New methylene blue. What reagent is commonly used for the quantitative determination of hemoglobin levels? The correct answer is A. Drapkin's reagent. What term is used to describe the presence of abnormally shaped or irregularly shaped red blood cells in a blood sample? The correct answer is B. Poikilocytosis. What is the term used to describe the staining property of red blood cells where they exhibit a bluish-gray coloration? The correct answer is D. Polychromasia.
That's a wrap. Tally up your scores and let me know how you did. Make sure to like, subscribe, and hit the notification bell so you never miss another quiz video.